Today's topic is dealing with an angry or upset patient.
So let's get started. Today's protocol was developed by Dr. Dike Drummond. He is a family practice physician, trainer, and founder of thehappymd.com, which is a site that is dedicated to helping medical doctors deal with the stress of being a physician. I've seen it many times in the hospital. There have been people lashing out because they felt as if they had been kept waiting too long, or somehow they were disrespected, or the outcome they expected was not the reality of the situation. There are many reasons why patients can become angry. Sometimes anger is also a symptom of disease. For example, chronic pain causes extreme irritability and mood swings.
That's right. There are all kinds of stresses related to being a medical doctor. Besides the physical stress from the workload, there is also the psychological stress that comes with having to deal with people. This includes coworkers and patients alike. One of the most common stressors for physicians is dealing with angry patients. In order to handle yourself in a situation where the patient suddenly becomes angry at you, it's important to learn Dr. Drummond's Universal Upset Patient Protocol. This simple step-by-step procedure is not difficult to master and may save you much hardship in the future.
I quite agree with you. It is simple but very profound. I've actually used this to deal with angry people myself, and I've seen some really great results. So it's not just for patients, but it can work with anyone who may be a little bit upset.
We do have to warn you though. If a patient shows signs of being irrational, mentally ill, or excessively angry, to the point of potential violence, you should not engage but instead seek the help of hospital security. The Universal Upset Patient Protocol is only universal when it comes to patients who are otherwise rational but extremely upset in the moment.
That's right, so please do use this protocol with caution.
The first step of the Universal Upset Patient Protocol is to not run away from the situation. Do not take the patient's anger as a personal attack. Do remain calm and professional. Do face the patient. When dealing with upset people, our first response is to become defensive. However, this will only escalate the problem and not solve it.
Your job as a physician is to get the patient to calm down enough so that you can continue the clinical interview and either diagnose the disease or continue with the treatment plan. Becoming defensive and pushing back will not solve anything.
Some of the common reasons why people become upset are 1. They've been kept waiting too long. 2. There is a gap between expectation and reality. 3. They felt neglected, ignored, or disrespected. 4. Extreme pain and anxiety. And 5. Feeling of insecurity or hopelessness.
Please keep this in mind whenever you face someone who is angry. Rather than taking it as a personal attack, try to empathize with the person and see things from their perspective. If you can understand why the person is angry, it may make things feel less like an attack.
All right, let's get back to the steps of the Universal Upset Patient Protocol. We mentioned that step 1 is to face the patient. Step 2 is to say to that person, "You look really upset." At this time, most people will either acknowledge the fact that they're upset, or they will hide it. If the person admits to being upset, then let them speak until they have finished. If they deny being upset, don't push them too hard. Just go to the next step.
Step 3 is to say, "Tell me about it." Of course, some people may have already told you why they are upset in the previous step. If that's the case, you should not ask them to tell you about it again. In fact, it might make more sense to combine step 2 and step 3 by saying, "You look really upset. Tell me about it." I feel like inviting the patient to tell you about why they're upset will make it easier for even shy patients to share their feelings. That's why I think step 2 and 3 should be done together.
I think you are absolutely right. You're also right about the importance of letting the patient get everything out before commenting. It's important not to try to defend yourself or make excuses. You should just listen. And after the patient is finished sharing their concerns, you should immediately go to step 4 and say, "I'm sorry this is happening to you." Even if you believe you have done nothing wrong, you should still say, "I'm sorry" to the patient.
Next, in step 5, you should ask the question, "What would you like me to do to help you?" This is a great question because it allows the patient to become an active participant in the outcome. It's difficult to stay angry when you have been included in the process. By allowing the patient to state his or her requests, you are giving power to the patient, and it's the power of choice.
Unfortunately, patients don't always know what's best. That's why the next step is important. Step 6 is to say to the patient, "Here's what I'd like us to do next." Of course, everything you say after that should not dismiss the patient's fears and anxieties or any of the things that cause the patient to become upset. The point of this is to bridge the gap between reality and the patient's possibly unrealistic expectations. In all likelihood, it was the gap that caused the patient to become upset in the first place.
Once you are sure that the patient has calmed down and you both understand each other better, then the final step, step 7, is to say to the patient, "Thank you so much for sharing your feelings with me. It's really important that we understand each other completely. Thank you." By this time, most patients will have completely calmed down. Some patients will try to pretend to be angry a little bit longer just so they don't feel silly about having become angry in the first place. However, unless there is a deeper issue causing the anger, you should be able to get on with taking care of the patient. You know, patients can also become upset in the middle of a doctor-patient interaction, not just at the start of one. As soon as you notice a patient is upset, it's important for you to stop what you are doing and say the words, "You look really upset. Tell me about it." Only after the issue has been resolved should you continue with the original objectives.
Don't forget that your job is to reassure the patient that you are working on his or her behalf. If you show your sincerity as a professional and as a medical doctor, and if the patient knows that you are working on their behalf, most will let go of their anger.
Now that we've described the Universal Upset Patient Protocol, let's take a look at some video clips which show the right way to deal with an angry patient and the very, very wrong way.